Hello everybody. In this video we are talking about heart failure, so this time about the diagnosis of heart failure, or better, how we can diagnose heart failure in our patients. So my name is Andreas Flammer. I'm deputy of the heart failure clinic at the University Heart Center in Zurich in the Department of Cardiology. So how actually can we diagnose heart failure? So for that we need to fulfill a couple of criteria. First, we need to have typical symptoms and clinical signs in our patients. Second, we need a structural and or functional cardiac abnormality, which is normally assessed by imaging tool as, for example, echocardiography. And third, we need to have a reduced ejection fraction, that means a reduced pump function of the heart, or a reduced capacity to relax during the blood inflow into the ventricles, which is called diastolic dysfunction, which may be a problem at rest or with exercise. But let's start with signs and symptoms of heart failure. If we have a patient, he may have typical symptoms. One of them is breathlessness, meaning dyspnea. The patient has problem, for example, going up the stairs because of his breath. He may also have orthopnea, meaning that the patient cannot lie flat in his bed because of his dyspnea. So he has to sit up in his bed to relieve for his symptoms. And another very typical sign is paroxysmal nocturnal dyspnea. That is, if the patient wakes up during sleep with dyspnea, so he has to get up, sitting in a chair to get relieved. It's a very typical sign of heart failure. But also reduced exercise tolerance, fatigue, tiredness, increased time to recover after exercise, or ankle swelling may be reported by the patients. And of course there are other symptoms as well, but these are the most typical ones. So if you look at the signs, the doctor can find very specific ones are elevated jugular venous pressure, hepatojugular reflux, or a third heart sound, that means a gallop rhythm, and other signs, of course, we will find as well, which may be less specific. But there are many signs and symptoms, of course, we assess as doctors. So if we have such a patient reporting us with symptoms, or we see with signs in the physical examination, we should dig a little bit deeper and assess the probability of having heart failure. So we will ask the patient whether he has a clinical history of, for example, myocardial infarction, hypertension, or may have a cardiotoxic drugs intake in the past, or radiation, which all increase the probability. And a doctor will also perform an ECG. So in case all the things are normal, then heart failure is really unlikely. And we have to consider other diagnoses. However, if we still have the possibility to have a heart failure, we should assess a blood test to assess natriuretic peptides. So these are vasodilatory peptides in the blood, which we can measure. And there have been nice studies showing that if a patient is coming with dyspnea and we take these measurements, and these measurements show a very low level in the blood, then the patient does not have heart failure. But the more elevated this test is, the BNP, the more likely the patient has heart failure. So we can say that if these natriuretic peptides are very low, then we can say heart failure is very unlikely. And also here we have to consider other diagnoses. If they are elevated, we should go further and to apply an imaging test, most likely echocardiography. So echocardiography is a very good tool for the doctors, and it's really the key imaging modality in case heart failure is suspected. Because it not only shows the cardiac anatomy with its geometry, the mass, the volumes, but it also helps us to assess cardiac function. So we can see pump function of the left ventricle, of the right ventricle. We can see the wall motion, which is maybe also impaired in coronary artery disease. We can look at valvular function, pulmonary pressures. We can also assess the pericardium. So it's a really good tool. And here in this image, I show you that some of pictures of echocardiographic assessment, and we have really several tools within the echocardiography examination to really help us to look for the etiology, that means the cause of the disease. So that's a good thing to do. So if we have done that, we can also see what form of heart failure the patient has. Nowadays, we differ between 3 forms of heart failure: HFrEF, HFpEF, and HFmrEF. So this word sounds quite funny, but it means that HFrEF is heart failure with reduced ejection fraction. We have also HFpEF, meaning heart failure with preserved ejection fraction, and HFmrEF, heart failure with mid-range ejection fraction. So how are these defined? You can find that in this image. We have HFrEF, symptoms and signs of heart failure, and reduced ejection fraction. That's enough to diagnose HFrEF. On the other hand, we have HFpEF. So this is heart failure with preserved ejection fraction. So pump function actually is normal. He has the same signs and symptoms as the patient with HFrEF, but normal ejection, normal pump function. But we have another problem. We have mainly a diastolic dysfunction, a problem in filling. So we need for the diagnosis also elevated level of natriuretic peptides and at least one additional criterion: relevant structural heart disease with hypertrophy and or left atrial enlargement and diastolic dysfunction. So we have these 2 extremes, and all in the middle we call nowadays HFmrEF, heart failure with mid-range ejection fraction, as you can see in the middle part. So to summarize, clinical signs and symptoms, of course, are very crucial for the diagnosis of heart failure. There is no heart failure without signs and symptoms. A normal ECG and a normal natriuretic peptide virtually excludes heart failure. And in addition to the signs and symptoms, diagnosis is mainly based on echocardiography. And we have 2 major types of heart failure: HFrEF with reduced ejection fraction and HFpEF with preserved ejection fraction. Thank you very much for your attention.